Hello, my name is Victor Lowe, and I guess today we'll be talking about cognitive reasoning and emotional reasoning. So this is like basic psychology. Usually, you learn this in college or high school, if you want. You know, I think. I'm not too sure. Been out of school for like 10 years. 10, 3, no, 4 years. Anyways, get this stupid dandelion puffy things away. And cognitive reasoning is the mind, basically. It's how you think. That's cognitive reasoning in a nutshell. You know? And emotional reasoning is emotional reasoning. It says it right there. But anyway, so what does it mean, to do cognitive reasoning? Is you think about things, it's how you learn, how you think, how you act. Emotional is how you feel. Sad, happy, joyful, glad, sorrow. That's emotional reasoning. Cognitive reasoning, yeah. I think I said that already. Like 15 seconds ago. But anyways. Basic psychology, So how do you become a psychiatrist? Well, quite simple, Go to school. Go to med school. Pass the 7 years of med school, and you do 4 years of psychology. In psychiatry, I think like 3 years of it's like practicum or something. I don't know. And then, you gotta diagnose them. It's pretty hard to do because sometimes they don't talk to you. Or they do. Or they're like, you say like gibberish, you can't understand what they're saying. So, that's basically it. So, basic psychology. Psychiatry, mental illness, addictions. Like there's counseling too, like marriage counselor or psychotherapist or whatever, or a therapist. That's pretty much it. There's different medications that you need to know, like clozapine, risperidone, Zolodox, Clozaril, Seroquel. I think that's Epiburol. Yeah, I think that's about it. Then there's like depression, like when you feel sad, that's sad. That's not depression. Yeah, there's a Prozac, that's the easy one to everybody knows, Prozac. And there's bipolar, like mood swings. No, is it mood swings? Yeah, it's mood swings. Happy, sad, fluctuates. Doesn't matter the situation, it's just, you fluctuate. Bipolar, schizophrenia, schizophrenia. Usually hear voices, it's pretty severe. Schizophrenia is the worst kind of mental illness, but, there's cures for those now, which is good. So, I guess schizophrenia is like you hear voices, you're withdrawn. You have hallucinations, illusions, grandeur, suicidal kind of thing, Depression is also suicidal too, so, usually they stay in the hospital, but, what else is there? Bipolar, schizophrenia, depression. ADD, was it attention deficit disorder? You don't want to diagnose a kid with that, because they're, kids are hyper, so usually when they're like 20 or 22, when they reach like college or something, they still can't concentrate, then maybe you give them the pill, but it's up to the doctor's discretion, when to use it and when to not. And there's ADHDs, which is attention deficit hyper. Which I don't know. They're just hyper, right? It's like the same. It's the same ADD and ADHD is the same thing. So, addictions. Yeah, that's pretty hard. Usually, there's methadone, but I have no idea what that is. No, usually if you're like addicted, they like send you into a room and you go through withdrawals, right? They watch you, usually, in a padded room with a bed. There's no toilet because you go outside to do the toilet. And usually it's pretty harsh, it's hard to see, hard to watch. And, they go through the withdrawals, and then that's about it. And good. Your body readjusts to it. It's a homeostasis thingy-majig, so, So, psychiatry, yeah. Mid school, 4 years practicum, 3 years practicum, 1 year. I don't know what they do in the 1 year, but anyways. And if you want to be a psychologist, yeah, PhD in psychology. Therapy. Talk to them, be their friend. Usually the psychiatrists or the nurse is their friend, so, they have friends. And that's it. I think I'm missing something. Psychiatry, bipolar, schizophrenia. I think I'm missing something. I think that's it, yeah. I'm missing something. Yeah, like after they're cured, they usually return to their normal life, but the stress, if it gets too high, they could have another break, which is, it's okay. You just go back on the meds, and after a while, you go off them, back to normal, So, that's it, So if you want to be, like, there's also occupational therapists that work with mental illness people, and yeah. Psychiatry is pretty hard, but it's probably one of the hardest ones, you have to be like a kind of mind reader kind of thing. But if you have like a mental illness, it's easier to be a psychiatrist, because you understand what they're going through. No one knows the cause of it, but I don't know what causes it, but it's usually chemical imbalance or something, It could be like the environment. There's pollution in the air, or heavy metal poisoning, stuff like that. I think that's it. So cognitive reasoning is the mind, emotional reasoning is emotion. That's pretty much it, So 5, 4, 3. Okay. Thanks for listening. If you have any questions of how to be a psychiatrist or psychologist, leave a comment down below and I'll answer it. Okay? Thanks for listening. Bye-bye.